So those who missed, you can tell your classmates to catch up on YouTube channel. Yeah. So doctor, monozygotic twins in contrast to dizygotic, environmental factor is responsible. So that's the reason recurrences are unlikely in case of monozygotic twins. Now coming to once more twin pregnancy. If you take cord prolapse, fetal mortality is 40 to 50%. Sana, what is your wrong answer? Jaldi bolo beta. You are not telling loudly.
B, sir.
Why B? What is B? Hydrocephalic fetus. You call if it is more than BPD, biparietal diameter is more than 85. More than 93. Normal BPD is 93. More than this, bit dilated ventricles, then you call hydrocephalus. Recently, COMED-K exam we have discussed, no? What is that beautiful question? Largest transverse diameter was the question. Even I too got confused about occipitofrontal, but what he asked was a transverse diameter. Okay. So those who missed the COMED-K 2014 discussion, excellent paper it is. We have it online on the youtube.com/online MBBS. From this Monday we will be having anatomy. Monday to Friday, Saturday will be subject test. 2 weeks of anatomy from Dr. Muralidhar Reddy sir, excellent teacher in anatomy. You will really enjoy listening anatomy from an anatomist rather than a general medicine guy like me. So please do take an opportunity. Evening 3 hours is a small break from your routine life. Though the representation of anatomy is only 5 marks in forthcoming entrance, not for forthcoming, at least for future exams for your juniors, you can tell them. Now doctor, elective cesarean section in a twin pregnancy के लिए सच्चाई का indications क्या है? PIH is not an indication for cesarean, is what need to be basically remembered. That's right, Naina is absolutely right. Pregnancy induced hypertension is not a indication. Cesarean in a mild contracted pelvis is indicated in all these scenarios except where? Naina, आपका आंसर क्या है बेटा?
D.
Sana. D?
Yes.
Beautiful. Primigravida with vertex presentation. What makes you to go for cesarean, doctor? If it is a mild CPD, still give a try. Of vaginal delivery is what need to be remembered. Prolonged first stage labor. What is not a cause? Which one is a cause for the prolonged second stage labor? Push. Oh, I can't push. When will patient tell? You will be shouting push. Abdominal muscles को पहला push करने के लिए होना है ना strength. अगर आप epidural देके बैठ गए तो epidural can sometimes be responsible for a prolonged second stage. Not always, once more. Is what need to be remembered. Sometimes the fetus comes to station 0 and say I will not move further. So in all such cases, already if you tried all your efforts and epidural is running since long time, abdomen loses its ability to push any more further. Commonly reaching up to 0 station and not progressing anymore, common cause क्या होता? गले में cord is a common underlying cause. Retraction ring. What is your answer, doctor? Obstructive labor में क्या आता? Retraction ring, right? So you must be sure on both types of rings. Differences एक table रहता ना? Then rupture of uterus least likely with a myomectomy scar. अगर इसके पहले यूट्रस को आप मैनिपुलेट करके मायोमा निकाल के स्कार करे तो it heals well, least likely. But any other thing is a important predisposing factor. Postpartum hemorrhage If you want to prevent, what will you basically do, doctor? Give one confident answer. Methergine with the delivery of the anterior shoulder. It is a important maneuver. But if you give uterotonic after the third stage, it cannot prevent the PPH. So you must be quite sure on the active and passive management of placental delivery, everything. You need to be quite sure. A primary gravida starts bleeding profusely in the 6th week postpartum. Uterus is 14 week size. What is the probable cause? 6th week postpartum. By that time, what do you expect in puerperal period? To regress. Uterus must go into pelvis, no? It remained in enlarged state. So that is a classical example of choriocarcinoma is the probable cause, is what need to be remembered. Bilateral interlinear artery occlusion to control the bleeding. What is accept about it? Concealed hemorrhage. Why? Concealed accidental hemorrhage में bleeding किसके वजह से होता है डॉक्टर? Disseminated intravascular coagulation and coagulopathy के वजह से होता. वहां क्या करना पड़ता? You have to give fresh frozen plasma, replenish the clotting factors, not clamping the aorta and all the major vessels. So you must know the pathophysiology of PPH fundamentally. Pathophysiology of obstetrical hemorrhage. Now, safe contraceptive at 6 weeks, lactating woman. Without a question on contraception, paper nahi hota. What is your answer?
Progesterone only.
It is the progesterone pops. Only pills is what you need to basically remember, doctor. Success of induction of a labor. किसके हाथ में है? Director के हाथ में. What is your answer, doctor?
Gestational age.
It is the gestational age, which will be basically the determining factor. Bishop score. How to calculate Bishop score? How much is a good score? All these things. Tips में रहना डॉक्टर. Gynos बोले तो 30 out of 30 marks you have to score. Induction of the labor. Where is it not indicated, doc? Induction of labor. Anemia के लिए induction क्यों करते डॉक्टर? Eclampsia, UGR, previous intrauterine fetal death. In all these scenarios, induction को role है. So all the fundamental prerequisites, contraindications, forceps, ventos, induction, cesarean, you have to be episiotomy, you must be ready and brimming, doctor. Suburethral diverticulate. Why do you see? Once more, Bartholin cyst. All these important conditions are to be reviewed. Skene's glands, periurethral glands, they are those tubuloalveolar structures. They are there along the dorsolateral aspect. Any repeated infection of them will lead to the development of the suburethral cysts, is what you need to understand. Glycogen. When will you see, doc? In the endometrial glands. Typically post ovulation during the luteal phase is the time where glycogen get deposited. Round ligament का काम क्या है? And all the supports of uterus is a favorite topic of the examiner. Retro displacement prevent करने के लिए the main function of round ligament, which will maintain the anteversion of the uterus during pregnancy, is what need to be understood. All this lead to lutein and theca lutein cysts, which are because of the excess levels of HCG, but not in Steen Levanthal, mole, abortion, pregnancy, जहां भी आपको HCG levels ज्यादा है, तब आप lutein, theca lutein cysts is what you will basically see. Steen Levanthal में anovulation है, so it won't be responsible for a lutein cyst, right? Now Tubo-ovarian abscess, if it is there, what do you want to do? It's a short answer question in the MBBS. TO abscess, TV abscess, TO. So, uterus, tubes and ovaries. The treatment of the tubo-ovarian abscess all depends on the age. If young, we remove affected tube and ovary. If old, we will remove ovary, tube and give a Dasara discount of also removing uterus without charging, depending upon the age. Interstitial uterine myomas. Why do they basically lead to menorrhagia, doctor? Interstitial, they are there within the wall of the muscle of the uterus. So there's a reason they inhibit the uterine contractility and lead to uncontrolled bleeding in the form of menorrhagia. One question on ovarian tumor, doctor. Without that, you don't call it paper. Pregnancy may. It is the dermoid cyst which will grow to magnanimous proportion leading to torsion. Stress incontinence क्यों होता? Commonly, it is the granny ma who had 6 children or 10 children. Childbirth trauma, doctor, will make all the ligaments lax. Whenever she is laughing, she will be spilling out the urine. So, stress incontinence. Bartholin's gland, last but not the least, where will it open into? It is the middle third of the labia minora is what need to be remembered. So, thanks for the patient listening, doctor. So, once more on Sunday we have a grand test, and those who could not take Sunday grand test due to some or the other entrance, Monday we will repeat the same. Oh, Monday we can't repeat because from Monday our anatomy session will start. Please do come. It will be a good review. One day upper limb, one day lower limb, one day head and neck, one day brain, one day embryology, histology. 10 days will be over. Right, doctor? Thank you.